Hi, my name is Maddie,
And I'm Hayley.
and we had the drug Avonex. So what it is, it's interferon beta 1A, and it helps in the treatment of relapsing forms of multiple sclerosis, or MS. MS is a long-lasting disease affecting the brain, the spinal cord, and the optic nerves. It involves the immune system attacking the myelin sheath, which surrounds the axons, and it causes damage to neural connections. People who have MS have difficulties with vision, muscle control, balance, energy, and symptoms vary from person to person. Other treatments that have been used for MS include IV steroids, glucocorticoids, disease-modifying drugs, off-label drugs, deep brain stimulation, plasmapheresis, botulinum toxin, and PT and OT. And Avonex is considered a beta interferon that aims to decrease the severity and frequency of symptoms and helps slow the progression of MS. We just have some pictures kind of outlining what MS is. So on the left, you can see a healthy neuron with the myelin sheath that allows for the passage of messages along the axon. And then on the bottom there is a damaged nerve that would happen with MS, and there's demyelination in spots, which causes a distorted or interrupted message. And then just some symptoms you can see with MS are within the central body, which would be fatigue, depression, impaired cognition, and mood swings. Within the muscular system, you can see weakness, spasm, and ataxia. In the intestines, you can see incontinence, diarrhea, or constipation. For their vision, you would see nystagmus, optic neuritis, or diplopia. In the throat, you would see dysphagia. In the nervous system, pain, hypoesthesia, or paresthesia. And in the urinary system, incontinence or frequency of retention.
So the pharmacological class for this drug is an immunomodulator, which means it works on the immune system. The dosage is given once a week intramuscular. So you start off the first week only taking a fourth of the dose and then increase for 4 weeks just to avoid flu-like symptoms. You want to make sure to rotate the sites. And there are 3 different forms of administration. There's a powder form, which you mixed in a vial. There's a pre-filled syringe, and there's a single-use pre-filled auto-injector pen. So here we have some pictures so you can see the 3 different administration types. We also have a picture of how you would administer the drug and just some dosage scheduling. So the indications for Avonex are people with relapsing forms of MS in order to slow the progression and accumulation of symptoms, so to decrease the number of flare-ups. It's approved for those who have experienced a first attack and have lesions consistent with MS as seen on an MRI. Some contraindications or precautions include hypersensitivity of allergies towards any of the ingredients, a history of anaphylaxis, depression, suicide, psychiatric disorders, or etc. If you're pregnant or planning on becoming pregnant, if you have any liver injury or issues, if you've had congestive heart failure, any damage to the small blood vessels in the vital organs, development of new autoimmune disorders, or previous experience of seizures.
The adverse drug reactions for Avonex include flu-like symptoms like muscle aches, fever, tiredness, chills, asthenia, which is weakness, headaches, myalgia, muscle pain, GI issues, liver problems like liver failure, which would manifest as nausea, loss of appetite, tiredness, dark-colored urine, or pale stools, and thyroid problems, which can be seen through problems with concentration, heat regulation, weight changes, and skin changes. There can also be injection site reactions, blood problems, heart problems, and behavioral health problems like depression, suicidal thoughts, hallucinations, irritability, nervousness, anxiety, and aggressive behavior. The mechanism of action, or pharmacokinetics. So we kind of found some different information on this. The Avonex website said that the way Avonex works in MS is not known. From some other websites, we found that interferon beta 1A is made from human proteins called interferons thought to modify the immune processes responsible for injury to the nervous system from MS. And we also found that Avonex is an interferon, which is a group of glycoproteins produced by the body to fight viral infections and other foreign matter. Avonex contains all of the same basic components as the interferon beta that occurs naturally in the body. And interferons help control the immune system activities, and Avonex helps to inhibit inflammation that can cause MS flare-ups.
It's important to monitor a patient while they're taking Avonex, so blood count and liver function testing needs to be done prior and during Avonex treatment. The first injection is given in the presence of a medical professional just to make sure they don't have any side effects. Regular testing during Avonex treatment is done for complete blood and differential white blood cell counts, platelet counts, liver function, thyroid function, and cardiac function. And also you're going to want to watch out for allergic reaction. Signs of that could be itching, swelling of the face, eyes, lips, tongue, or throat, trouble breathing, anxiousness, feeling faint, skin rash, hives, blisters, or sores in the mouth. Some special considerations to take into account is that Avonex should be stored in a refrigerator, but before you use it, allow it to come to room temperature. It's injected once a week into the muscle rather than the skin. It should not be injected into an area where there's skin irritation like redness, bruising, scarring, or signs of infection. The patients need to be able to check the skin changes at the injection site. A titration schedule is needed to slowly progress into the full dose, and in order to prevent flu-like symptoms during titration, pre-medication with Tylenol or ibuprofen is encouraged. Monitoring is a crucial part of the Avonex treatment.
So the first study we looked at was entitled Comparison of Beta-Ferron, Avonex, and Rebif in Treatment of Relapsing Remitting Multiple Sclerosis. It compared the relative efficacies of these three drugs. There were 90 patients that had RRMS, and they were randomly put into the three different groups. They looked at the relapse rate, and for beta-ferron, the standard deviation decreased from 2.2 to 0.7 episodes. For Rebif, it decreased from 2.4 to 0.6, and Avonex, it only decreased from 2.1 to 1.2, which isn't a significant change. They also looked at people who were relapse-free after 2 years, and they found that 43.3% of the people using beta-ferron were relapse-free, 56.7% of the people using Rebif were relapse-free, and only 20% of the Avonex people were relapse-free after the 2 years. They also looked at the scoring on the Expanded Disability Status Scale, which looks at the disability within patients with MS and how it changes over time. And for beta-ferron and Rebif, it both decreased by a pretty significant amount, but Avonex, it remained fairly stable. So in conclusion, treatment with beta-ferron, Avonex, and Rebif significantly reduced relapse rate and EDSS scores in patients with RRMS, and the 3 IFN beta formulations are useful tools to prevent the relapses and to slow down the neurological deterioration in RRMS, with beta-ferron and Rebif demonstrating more effectiveness than Avonex. So in conclusion, there are better drug options to treat MS.
The second study that we looked at was called Intramuscular Interferon Beta 1A Therapy, initiated during a first demyelinating event in multiple sclerosis. So the study compared the effectiveness of starting Avonex right after a first clinical demyelinating event instead of waiting until a confirmed MS diagnosis. So the study had 383 patients. They randomly assigned the patients into two groups. One group was getting Avonex once a week, and the other group was getting a placebo. They did this study over the course of 3 years to see how the patients would progress through the disease, and Avonex actually decreased the occurrence of an MS diagnosis by about half for these taking Avonex. So some PT implications. For patients with MS, it's important to discuss possible methods to decrease the progression of their symptoms, especially during their flares. So be aware of MS and what you will see in a patient. For patients taking Avonex, ask about their dosage and injection schedule to make sure that they're keeping up with that. Check their injection sites for skin irritation or signs of an allergic reaction. Understand the ADRs. Make sure they are getting their blood, liver, thyroid, and heart tested regularly, and remind the patient to rotate sites of injections. From the studies, we learned that you could recommend taking a different drug instead of Avonex, or you could recommend taking Avonex earlier.
And these are our references. And thank you for listening.